submitting the healthcare reform legislation?
We're drafting a bill, or working together with legislative leaders to draft a bill right now. Our healthcare leader on your radar is working on that with the entire team, and we want to have a bill into the committee as quickly as we can. This is going to be a joint effort. I want to tell you how grateful I am to Dr. Shumlin and his team for their work. This is really a historic moment for Vermont, that we can be the first state in the country that actually has a plan, a blueprint, that will allow us to build a single-payer healthcare system that will treat healthcare as a right and not a privilege, that will contain costs, and that will provide access. I invite anyone who can design a healthcare system for Vermont that will save $500 million in the first year to please submit the plan, because we would be all ears. You've got to contain costs.
There was some disappointment from some quarters that you didn't go with a sole government-run plan. Is that completely off the table now?
We got a lot of battles ahead. There are so many landmines in the healthcare reform efforts. And I don't think we should underestimate the casualties that have come along the way to some of the best politicians in America. President Clinton, Hillary Clinton, Barack Obama, Howard Dean. So let's acknowledge as Vermonters, we've got a problem to solve. If we keep spending $1 million more tomorrow than we spent last year on this time on health care, we will bankrupt small business, we'll bankrupt middle-class families. We cannot win this battle. We've got to contain costs. The mistake in every single healthcare reform effort, whether it's federal or state, including Vermont to date, has been that none of them have succeeded in containing costs. So to argue about whether it's more economical to actually run the payment system ourselves or contract it out to those that do it every day, I think is missing the point. I don't care. What I want is a system that contains cost, and I ask Vermonters to work together with us to help design it. It's going to be some heavy lifting.
Well, speaking of cost, there's if we cover 7% more people, there's already a shortage of primary care docs. Is there anything in your plan to bolster that part of our healthcare delivery system when we're, in fact, if this works, going to increase the demand for primary care?
Absolutely. And the answer is, we have to ask the question as a small rural state, why is it that we're losing our healthcare providers? Why can they not afford to stay in business? And the answer is, if you ask them, two things. One, they have insurance companies second-guessing their ability to deliver quality care. And two, and most importantly, they have a payment system that bankrupts them. And there's no other industry in the world where when you send out a bill, you get paid 40 cents from one payer, 50 cents from another. Every great once in a while, someone comes to the door that gives you $1 for a dollar's work. What this system that Dr. Shao has recommended does is get the federal waivers to pool all of our dollars into one pool, give our providers an honest day's pay for a hard day's work, get the insurers off their backs, and get rid of the reimbursement system that's driving them out of Vermont and driving them into bankruptcy.
Governor, how closely will your bill resemble Dr. Shao's option 3?
We believe that Dr. Shao's option 3 is the model that we should work off of. What you have to know about his architectural plan is that there are an awful lot of details that we have to all build together. So this is what we want to do going forward. We're asking Vermonters who have an interest in healthcare, whether it's consumers, insurers, businesses, individual families, to join us in helping design the system. We don't have all the answers. We don't have all the great ideas. We know we have to design a system that contains costs. And we want to be as inclusive as we can. But Dr. Shao has given us plans, a blueprint. Now we've got to really get into the nitty-gritty, and some of it is not in his plan.
Do you agree with the payroll tax?
I'm going to resist the temptation to talk about how we pay for it. Because I think if we make that mistake, we lose sight of the prize. The prize for Vermont is designing a healthcare containment system that works. This is about reducing the amount of money we're spending on healthcare. It isn't about spending more money. That's the hard part. Designing cost containment. No one has done it. We have an opportunity to do it. Let's get that done. Then we can talk about how we raise less money to pay for healthcare than we're raising now.
So no position on the payroll tax, or you made a decision on using a sharing?
Well, I think Dr. Shao's recommendation that we use a payroll tax is a prudent one. There are other options. All I'm saying is that the really hard part here, the real challenge, is design a system that provides quality care and spends less money. And we will not convince anybody that we are doing the right thing, and we will not be doing the right thing if we can't design a healthcare system that spends less money. Period. That's the
But
hard
off the
part.
bat, is that payroll tax doesn't erase your concern about it being linked to one's job.
Well,
Linked to an
what
employer.
matters to me is that we have a healthcare system where your coverage follows the individual and is not a requirement of the employer. That's very important.
If employees, or rather, if companies with fewer than 10 employees are exempt from the payroll tax, as Dr. Shaw indicated yesterday, how do all of the small farms and loggers and people, sole practitioner, carpenters and painters and so on, tradespeople, participate in this out there?
Well, there's a question that we're going to have to work through in the legislative process, because it really gets to the question of how we pay for it. The question I keep asking is, how do we pay for the system that we have right now? And the answer is, we cannot continue to. So I just want to reiterate the challenge. Let's be specific. Where does Dr. Shao get his $500 million savings the first year? It comes from two really pretty simple ideas. The first is that we use technology to allow you to pay the bill when you come out of the provider's office, your share, which reduces the extraordinary amount of money that we're wasting chasing money around. The second is to actually use medical technology, your medical records, in that same card to reduce waste and reduce cost. This is a technological challenge. It should not be underestimated. What does it require? Every provider has to be hooked up. Therefore, we can't deliver until we have broadband and cell service to every provider in the state. Second, they need to have the technology. Third, we need to design the system. So let's focus on the challenge of doing something that no one else has done anywhere in the country, designing a smart, sensible healthcare system that contains cost.
The expectations getting too high here now for the public, because if we got the 2017 date, maybe 2014, you just mentioned we can't really do this until we get broadband and all this technology up and running. The public may have the impression that this thing's going to kick into gear in a year or two. It's not going to happen, right?
No. We should be very clear that our goal is to have a healthcare system by 2014, when the federal bill kicks in, that provides universal coverage, healthcare system that follows the individual, that contains cost, and uses technology in the ways we just outlined. 2014 is the realistic date where we can actually push the button and have a new delivery system.
And it looks like under the third plan, you're only going to have one insurance company left in Vermont. Is that accurate?
That's correct. And what really he's recommending is that, or what it seems logical to me that you would do, is bid it out to any of the providers that could provide the service to Vermont for the least money. I just want to point out that this is not new to Vermont. If you were on VHAC, that's exactly what we do. We oversee the benefits package. We oversee the coverage. We contract it out to HP right here in Williston. So this is not a new concept.
And it looks like Blue Cross is probably pretty happy about this bill. Is that accurate?
What's that?
Blue Cross would be pretty happy with this bill. It looks like it's sort of written to keep them in business.
Yeah, I'm not gonna comment on who might get the contract, and we don't know that. We've got to work out the details of the bill, and I think to suggest that we already have the payer is premature.
Medicaid residency, would you have to be here for a while, a Vermont resident for some time before you get these benefits?
Well, sometimes we make this more complicated than it needs to be. if you move to Vermont right now, and you qualify for BHAC, Dr. Dinosaur, or Catamount, there is no requirement that you wait before you're in. So there's no reason why this system would be any different. What would be different about this system is that we'd be the first state in the country that has an affordable health care plan with universal coverage that follows the individual.
Medicaid recipients currently get benefits that are more generous than those described by Dr. Shaw yesterday. So presumably, if they all became part of this one pool, they would see a reduction in their benefits, and someone getting a $200 pharmaceutical would have to pay $46 for this, the balance off of 77% for drugs. And many low-income people couldn't afford that. So low-income advocates, I'm hearing, are somewhat concerned about what might happen here. How do you allay those concerns?
By saying what I just said, we're inviting everybody to the table to help us write the bill. Dr. Shaw's recommendation is not the bill, it's a recommendation. And it's up to the governor and the legislature to work together with all of the constituencies, including low-income advocates, to make sure we write a bill that makes sense for Vermont.
How soon would you like the House to pass it?
Well, we want to leave this session with a bill that I can take to Washington that simply says, as much as we can be specific about in the next 13, 14 weeks, Vermont is committed to a single-payer bill. This is roughly how it will work. We need these waivers, and Mr. President, Congress, we're asking you to help us get them.
So will that bill include a financing mechanism? You said you're not committing to payroll tax, but when this bill is introduced, will it have a way to pay for it?
My own judgment is that the hard work should be done first, and that is, how do you design a healthcare system that contains cost? I will not sign a healthcare reform bill that simply provides more access to Vermonters. I just won't do it. I will only sign a bill that reduces the $1 million a day that Vermonters are spending on healthcare.
Right, but it's got to be paid for somehow. Right now, it's paid for through employer contributions. If that system, if you're changing it, would this bill that the legislature is going to consider in the next 14 weeks include a financing mechanism?
I don't think it needs to. I think we first need to pass the cost containment mechanism that will work. We all know that it's going to get paid for. The question is, are we going to design a system that's going to cost less and be more affordable for Vermonters? And that's the hard work.
How can we know if it's gonna cost less if we don't know how we're gonna pay for it?
Because right now we know that we're spending over $5 billion a year on healthcare as a state. We know that that's up from $2.5 billion 10 years ago. And we know we're raising the money. We're spending it. So the question is not, will we spend it? The question for Vermont is, can we design a system that will not spend more? And come on, you all know what's going on. I mean, 10, 20% increases in health insurance premiums for small business, for employers. It's not sustainable. So the challenge here is not access. It's a small challenge. The challenge is to design a system that costs less.
In what ways do you think your budget might fuel the urgency around here to do that redesign?
Well, I think the urgency has been fueled by lots of factors, one of which is the necessity of government in tough times to balance budgets on the backs of hospitals and providers by reducing reimbursement levels and by finding creative ways to draw down more federal dollars. My budget will not be immune from any of the techniques that have been used by past governors.
So to clarify, you want to leave this session with a bill that you've signed?
That's correct.
And this would be a comprehensive bill, or are you going to do this in several parts of legislation, piece of legislation?
We're going to do as much as we possibly can in the 14 weeks that we have left with the legislature here, and understanding that there's a lot of work to do this summer and fall, and as Anson just pointed out, we've got to be able to have a system up and ready to run in 2014. So we'll get as much work as this in the legislature and we can get done, and then come back next year and go back at it.
But if you get a bill passed that before you get the federal waivers and federal clearances and so on, and then you go to Washington and ask for those, in that interim period, the bill would theoretically anyway be in violation of federal law. Aren't you worried about court challenges from whoever might whoever might by then be opposing the bill?
Well, we won't pass anything that's in violation of federal law. I think it's important to note that you're only in violation of federal law if you actually implement the plan, not if you pass it.
So the bill will say things like, we will do this subject to federal approval or something like that?
The
We'll
Se-
be creative.
The Senate,
We'll stay out of jail and get a job.
the Senate leadership yesterday was saying that they didn't think this was possible this year. They wouldn't rush. This would be a 2-year effort. It would be next year before legislation could pass. Have you had a come to Jesus meeting with the Senate leaders in the last few hours, or how do you reconcile that?
Well, you know, this was all getting unveiled yesterday, but I very much want to leave here with a bill that gets us started as much as we can this year. You know, we've faced other big challenges legislatively and historically in a similar way. You may recall that when the Brigham decision came down, which was in February is my recollection, the legislature worked very hard in the time that they had left to sort of pass the embryo of a plan. They worked in the summer and fall, came back the next year, asked more, and it's been an ongoing effort. This healthcare effort is going to be an ongoing challenge. And you know, I think it's really important that we be honest with Vermonters about what the challenge is. This is about spending less money so that we can grow jobs and economic opportunities for Vermonters. If we're the state that can get this right the first time, it's a huge job creator.